first and foremost, welcome all of you, both in person and those joining via webinar, to our first quarterly Washington Wellness Training for the year, Promoting Brain Health in the Workplace. Very excited about it. Before I introduce, we have a wonderful guest panel of speakers today to share their expertise with all of us in this area. But I just want to go over a little bit of housekeeping information, and then I will introduce the panel. So we are recording the presentation, today's training, and we will send out an announcement with a link to that recording as soon as we have it available to us. And then also, we have sent out for those registered both on GoToWebinar and in person, of course, a link to our meetings and materials page. So that has been updated with the resource packet for promoting brain health in the workplace, as well as the PowerPoint presentation will be available for you. So that is there for you now. We'll follow up this training tomorrow with thanks so much that you joined us, and just adding the link again, so you can access all of that's available for you in that area. The resource packet, for those in the room today, we have a sample of the resource packet that again is online, and that will be looked at more specifically at our last segment when we start discussing and interacting and sharing ideas for actually promoting brain health in the workplace. So please know, folks, those online, that we're just going to be starting a conversation, sharing ideas. We have a couple of our speakers that will be facilitating that, and again, you'll be able, that packet is available for you. So, okay. And let's see, what else here? Sign-in sheet, so those that have joined us so far, just a reminder, if you haven't signed in, please do so before you leave today. And of course, those joining through the webinar, we will receive, a list of participants. So we're good there. And little information about opening it up for questions and comments. A lot of fun and exciting information on brain health today. So we've designated a couple of segments during the training to open it up to comments and questions. And the first one will be right before the break, and so of course we'll cue you. So please jot down comments and questions, and we'll open it up for the first segment of looking at those comments and questions right before the break, and then again towards the closing, we'll open it up. So jot those down, and those of you joining via GoToWebinar, please submit comments and questions in the question box provided for you. And then last but certainly important, the restrooms. If you go out the back door here and go down the hallway, there's a corridor, and to the right are the restrooms. Okay. Well, and that's the housekeeping. Again, we're so excited to have all of you join us. And I want to now introduce our speaker, our panel of speakers. First is Lynn Corti. She's the Dementia Care Program Policy Analysis with Aging and Long-Term Support Administration, and that's at the Washington State Department of Social and Health Services. So welcome, Lynn. Then there's Jamie Tudeberg. She is the Life Stage Coordinator with Clinical Quality and Care Transformation here at the Washington State Healthcare Authority. Welcome, Jamie. Then there's Maggie Christopherson. She is the Education Coordinator at the Washington Chapter Alzheimer's Association. And then there's Kim Concepcion. Some of you might know her. She's the Wellness Coordinator with the Center for Public Affairs at the Washington State Department of Health. So thank you so much for being here and sharing what you can contribute. It's very much appreciated. I also want to give special recognition. Oh, and I stay on cue here. Yeah, there they are. I wanted to make a special note and recognition to Marcy Getz. She could not join us in person today, but she was instrumental in bringing us together as a panel and developing and planning this training through her technical assistance and support. And so she really wanted to say special thanks and recognition to Marcy Getz. All right, so let's take a little closer at what we hope to accomplish today. I just want to start up saying that when I started looking around. I call it my discovery phase, you know, when I'm interested in a new topic and want more information. And boy, very early on in that process, it was evident that there's a lot of energy and interest around brain health and understanding more. There's been a lot of research that's been done, some really interesting findings so far. But as the panel and others have cautioned me that there's a lot more left to do, but we're very much bringing to you today what is showing now. And again, there's more to come. So it's an ever-growing and evolving science for us to understand. And also I realize that I know that I like to look at other states, what are they focusing on for promoting employee wellness and that type of thing. And several states, such as South Carolina, are providing actual wellness initiative around brain health with employees and actual campaigns. For example, South Carolina, they have take brain health to heart. Take brain health to heart, and that's one that they've implemented. That's just one example, because research shows so far that the same risk factors that affect the heart also affect the brain. So there's campaigns that kind of link those two together, and you'll learn a lot more about that as we go through the information today. So anyway, we're going to make sure that you leave here and you understand more of what brain health is, how it's impacting the workplace, and also its impact in other areas as well. Some national and Washington state data that I think you'll find interesting. And also, what lifestyle interventions are showing, evidence so far showing that can be helpful to improve brain health. And then ending with us again, engaging in conversation and discussion examples at what workplaces can do to support a healthy brain work environment. So that's our goal and agenda for you today. So now I'm going to turn it over to Lynn Corti, and she's going to kick it off, and she's going to talk beginning about what brain health is and its impact overall. So welcome, Lynn.
Well, thank you, Pam, and thank you all for taking the time to come to this presentation. This is something I love to talk about, so I hope by the time you leave here, you'll also be equally interested in brain health. So to start out the day, we wanted to have you all do a little thinking on your own. And one of the things that we want you to think about is imagining yourself as you're getting older. Now, you guys are a lot younger than me, so I want you to project yourself out into the future. And I want you to think about if you imagine yourself as you're getting older, perhaps towards retirement age, okay? Imagine yourself. Now, I don't know what kind of role models you have in your life, but imagine yourself and what kind of older person you want to be. And think about what are the things you want to be doing as you're getting older and retiring. What do you want to be doing more of? So picture yourself in that world. So for those of you in the room, I think what I'm going to ask you to do is talk to the person next to you. If you're sitting alone, you can find somebody to pair up with. And just each think for just a few moments and then share just maybe for a minute or so. This is what I picture myself doing or doing more of. And then give the other person a turn. And if you're one of those many people on the phone, welcome. We're glad you're here. If you have somebody in the room to do that with, sort of turn to them and do the same exercise. Think about what you're looking forward to as your age and what kind of person you want to be. What do you want to be doing? And then if you're by yourself, just think about it, and then you can type some things into, is it the chat or the question? Question box. In the question box. And we'll have somebody being able to report out. So we're going to take about 5 minutes here. So do a little thinking and then a little chatting amongst you, and then we'll reconvene and talk about that.
And also, okay, yeah. And I want
When I was in Ohio, I volunteered at a wildlife facility. Oh, okay, yeah. And, I'd like to find something out here. But it's gonna sound Oh, I see. And then I actually converted to Ohio, but I'd like to retake it here. Yeah. And hurry up and go, hurry up and come back. But I know I'll look back and say, that was fast. So I want to travel, I also, well, of course, I volunteer, and I want to do local. And I know. I still think I haven't told. I mean, they're like, no pressure. Oh, yeah. Right. I'm three of them, the other three were out. And I told them how to know him. I don't know why. They are just
Hey, let's reconvene. I think most of you have had a chance to chat.
Plus, you've been matching.
Yeah, that's great. I've got 7 years. Oh, yeah. I remember that. Oh my God.
Okay, so I hope you guys have pictured yourself as you're getting older. I had a mother who was not supposed to live to the age of 30, and she lived to the age of 92. And she was a great role model for me because she was one of those people with high blood pressure and diabetes, and she was out like walking every day. So, I think we all do have different pictures in our head, right? Some positive, not so positive. Let's get some ideas of folks that are out somewhere on the go-to meeting.
We have someone that said when they think of retirement, they feel the need to establish self-care routines. Another person put that they're looking forward to a retirement community with friends and hubby to stay active and involved. And another one was, I want to experience new things such as traveling and learning new things and remain close to family and be connected to the community.
Excellent. Thank you, folks on the phone. If you have any other ideas as we go, feel free to chip in. Is there anybody in the room? Could I have someone over here? Anybody share some of your ideas?
I said I wanted to volunteer. I'm making steps right now to get trained as a hospice volunteer.
Excellent. We need more of you. Lovely. Anybody else? Over here on this side of the room? Yes, Kim?
I look forward to traveling and doing volunteer work in my local community as well, and probably continuing with athletic stuff.
Kim's very athletic. She does like Ragnar races and stuff like that. She's a good role model. Okay. Anyone else over here on this side?
Watching my kids grow up healthy and establish themselves in life, and then the wife and I will probably find somewhere sunny and quaint for us to just invest in something small and enjoy exploration and travel and just find something to keep us busy and enjoy the rest of life.
Nice. Great. Anyone else want to share over here? Over there, back there? Anybody else? Other things you want to add to the list? Anything different?
I think staying active, that's going to be the key, being outside.
You want to be able to do
that. Yep.
Okay. Any other thoughts?
More time to garden.
Oh, gardening. There you go. Okay. That's a good one. Anyone else? Okay. Well, those are some great aspirations, right? I think we need to think about whatever age we are, how we want to be and how do we get to be that way. Because one of the common threads in attendance, and this is like, well, in my field, I work in the aging field, and if you don't have the cognition to do those things, you know, you can have physical impairment and still be very active and involved, right? But you have to have the cognition and the ability to, number one, be independent and to do the kind of things, to make the choices that you want to do, and to be able to start them, not only initiate them, but be able to follow through, right? So it becomes very important that we find ways to maintain the health of our brain, okay? Now, as Pam said, the sort of science of brain health is really rather new. So there really isn't one agreed upon definition. But the one that we're going to use for today comes from the National Institutes of Health. And so that would be the ability to remember, to learn, to play, to concentrate, to keep a clear and active mind, right? When you think of our mind does a lot of things. It manages information. It allows us to manage information in a way that we can make choices. We can use logic. We can problem solve. We can use perspective and wisdom because our brain manages all that information, right? So we want to be able to maintain those things and reduce the risk to anything that's going to damage those abilities, or we're not going to be able to do those kind of things that we want to do as we age. So that's sort of the definition we're using, is being able to maintain a clear and active mind and reduce the risks to that so that we can maintain the health of our brain. So one of the things I want to address today is how we came to this issue here in the state of Washington as something that we really wanted to focus on for good health. Okay, so one of the things that's important to note, I've been working in the field of dementia for many, many years, and so I've been seeing the rise of people with dementia and working with their families of people with dementia, but it's just in the last 5 or 6 years that the dementia has become recognized as a public health issue. So why is that? Any guesses? Anybody out there want to throw out what you don't know? Anyone else? Sorry, she works with me. Any thoughts on why it's become more of a public health issue?
Is it just because it's been identified more?
Yeah.
I mean, it's more in the forefront.
There are some risk factors that are preventative.
Yes. Yes, there's more that's known about what you can do. So one of the things that started happening, I think, in the last 5 or 6 years, along with increasing awareness, is that we've had the aging of the baby boomers, right? So the baby boomers, they've changed marketing, they've changed businesses, and they are changing the way we are looking at aging as well. Because people are just living longer. Because of the success of public health and healthcare, people are living longer, right? People are living longer, and now we have this great big group of baby boomers who are coming up, and they are like shifting the curve, right? So we have a lot more people that are heading into that aging realm. Now, this is not just in the state of Washington. This is a global thing. So these are, countries like Japan, England, countries that are sort of, moving ahead, and they've looked at some of this stuff as well. So the other thing that we have become more and more aware of is that the risk for something like Alzheimer's or the dementia increases as you age. So if you look at the group of people 65 and over, the risk of having a dementia is like 1 in 10%. Every 5 years after the age of 65, the risk for Alzheimer's doubles. So by the time you get to the 85 plus age group, the risk for having something like Alzheimer's or another dementia is 1 in 3, 33%. What do you think is our fastest growing age group in the country?
65 to
85
85.
plus is the fastest growing age group if you look at the age groups of people. So this graph, I really like this graph, because what you see on this graph is not only when you're trying to project people with dementia, but you see that the 85 plus age group is the biggest group that's growing. And then the other age here, so this is the 75 to 84, they're at the next greatest risk for Alzheimer's, right? So when you combine the fact that we have all these older people, and baby boomers are what? They're like 55 to 75 right now, okay? So they're entering into this group, and we have more older people. So you see this rising curve, and if you look at this right now, we have 5.8 million people in the United States that we can estimate have Alzheimer's or related dementias. You put those things together, the rising population and the increasing risk, and by 2040, we're going to have double that, 11.6 million people with Alzheimer's or some other dementia. So how does that play out for Washington State? So what we know is we have that same slope, right? We have an increasing population. These are 3 different estimates, and you don't need to get down into the weeds on that. But you'll see that if we have 2020, we have 110,000 people right now that we estimate to have Alzheimer's or related dementias. You go out to 2040, we have the same thing. It could double or more than double. okay? Now, one thing you don't see on this graph, does anybody have somebody with Alzheimer's in their family or other dementia? So who does that impact other than the person with the Alzheimer's?
The entire family.
The entire family, right? So one of the things we also know is we have 348,000 family caregivers of people with dementia in our state. So if you put that together, we have a lot of people right now who are coping with this and living with Alzheimer's in their families. And we know there are impacts for families that can be very stressful. Alzheimer's can go for a long time. You know, on average after diagnosis, 4 to 8 years. It can go as long as 20, depending on how it goes. So families are involved in this for a very long time, and there are some real impacts on them. So, you know, even if we just look out 5 years, here in the state of Washington, we're going to have a 27% increase in people with Alzheimer's or other dementias. So this has really come to the attention of state policymakers. So back in 2013, when Governor Inslee was elected, older adult advocates groups who had been looking at this rising trend had gone to him and said, what are we going to do about this age wave? We have so many more aging people coming into our system. We don't really have all the systems in place. We need to get ready. So Governor Inslee did hold an aging summit in the fall of 2013. And one of the outcomes was a look at this and said, you know, we have this rising group of people with Alzheimer's disease. We need a state plan. And we did not have a state plan for how we were going to address Alzheimer's and other dementias. So we ended up, there was a bill that was passed, we had an Alzheimer's disease working group, and we created a plan. And what was really interesting is we had a broad group of stakeholders who developed this plan, and we went out and we did listening sessions, and we did surveys, and one of the real big interests of people out in the public, along with getting better services, of course, and better health care, was an interest in how can we prevent dementia? How could we at least reduce the risk or prevent dementia? So that's one of the things. There are 7 broad goals of that plan, and they involve public awareness, they involve health care, long-term care, but it also involves finding innovative approaches. And one of the strategies in the plan is to increase the public awareness about the connections between health and wellness, brain health, and dementia. So that is one of the reasons we're here today. And as Pam mentioned, there has been, even at the time, right when this plan was coming out, there was some really good evidence about that connection between heart health and brain health. But there has really never been any studies that have been able to say we can really prevent it. We have one way that we can prevent it, and it's very complicated. There are a lot of different things that can cause dementia, a lot of factors at play, and that's been one of the issues with that. So before we go any further, I just want to address a possible elephant in the room. Because whenever we do talks on Alzheimer's or dementia, people say, what is the difference? Anybody wondering what's the difference between Alzheimer's and dementia? Okay, I mean, it's complicated. And we throw out those words because certain studies or pieces of information use one word or the other. So I just want to address that. So dementia is not an illness itself. Dementia is a syndrome. And what that means is it's a collection of certain symptoms, right? The common factor in any dementia, if you think of it as an umbrella, is that there is damage to the brain caused by some illness or condition, okay? So if you look at these different things that are under this yellow umbrella, Alzheimer's disease is responsible for 60 to 80% of the dementias that we know about. So it's the one you hear talked about the most. But other kinds such as vascular dementia, Lewy body dementia, frontotemporal dementia are things you might hear about. Again, the common factor is that they affect the brain and the function of the brain. So to be considered a dementia, it has to affect the cognitive functions in your brain, right? So the one people know most about is memory, so that's a real obvious one. But other things that are real important cognitive functions are your ability to communicate and understand language, the ability to focus and pay attention. You might not think of that as a cognitive ability, but there is a real cognitive ability to focusing and paying attention to something. Reasoning and judgment, the ability to take all that information you have and make a sound judgment, and then visual perception. So you might, you know, the way you see something might look different. If a certain part of your brain is damaged, it might look different to you, okay? So in dementia, to be considered a dementia, you have to have 2 or more of those impairments, severely enough to interfere with your daily life. Okay, so that means the person is having trouble getting through the day because of those cognitive functions. So why is that important? Severely enough to interfere with daily life. Because there's something that's not on this screen, and it's called mild cognitive impairment. Have any of you heard of that or had anybody with that? Okay. Thank you. Mild cognitive impairment looks like dementia. So it might look like those things over there on the right. There might be memory loss. They might have trouble finding words. They might tell you the same story again and again. There might be some of those changes, but they're still getting through the day and it's not interfering with their daily life. Okay? And that's important because many of the cases of mild cognitive impairment can proceed on to dementia, right? I mean, it will eventually become dementia. But there are people with mild cognitive impairment who have that impairment for a different reason. So there are different reasons why people can get that kind of impairment. One might be, well, they could be on medications. I mean, some of these side effects of medications are pretty scary, particularly in older people. And if you read side effects, you will sometimes read it can cause confusion. So certain medications can cause that fuzziness or confusion, or when they're mixed with other medications or alcohol, they can cause confusion. So the things we think are helping them might actually be causing more problems. Other issues are problems with the thyroid, problems with clinical depression, vitamin deficiencies. People who drink a lot, alcohol issues often have vitamin deficiencies, and those kind of things can also lead to that kind of impairment. So the important thing to know is that when you see those kind of changes in somebody, yourself or somebody you know, it's important to get those checked because you might have one of those things that could be reversed. And if it's one of those things that's not a dementia, you can either have treatment, you can make some changes and not progress into dementia. Now, it might eventually turn into dementia, but it's better to know early. As with almost any chronic disease out there, it's better to know early because you can take steps to modify the experience. There might be medical trials you can get into, medications for certain symptoms. It's better to know early. Nobody wants to get that diagnosis, right? We know that, but it's important to know that early. I mean, I think one of the issues out there is that we know Alzheimer's is one of the most feared illnesses in the country. So people don't really want to know about it, right? They don't want to know that they have it. But knowing or not, if you have it, it's going to progress. So it's better to learn about it ahead of time and see what kind of changes you could make sure it's not something reversible, and then be able to make those plans. So part of brain health is understanding that our brain, as we age, does change, and you're going to have some minor changes. But when you start seeing something that looks like dementia that you even recognize that might be a mild cognitive impairment, get it checked. Go to the physician and see what they can assess and make sure it's not something that could be reversed, but it might be something that you can manage. Okay, so that's a really important aspect of brain health. So then the next thing I want to talk about, I did mention there's all these different illnesses, and that's one of the reasons it's been so hard for them in research to say, what can we do to either prevent or cure or treat dementia? Because there's all these different factors that come into play. So I said around the time we published the plan, there was a good knowledge and a good evidence base about heart health and brain health. But what started emerging around 2017, a journal called The Lancet, which is an international medical journal, they did a meta-analysis where they combined a whole bunch of studies that had looked at risk factors for dementia. And it was the first time they had enough data at that point to start putting it together and saying, what could we learn? Even if we can't prevent dementia for sure, what do we know are some ways we might reduce the risk for dementia? And if we target those certain factors, how much impact could we make? So you have in your folders a handout with this graphic on the left. And because this is sort of hard to see, I just wanted you to recognize it. You guys have it in your packet. It says risk factors for dementia. So the importance of this was that even though we still know that there isn't a way to cure or prevent for sure dementia or stop the progression, there's steps we can take to both modify the experience once you have it. That's something we're learning. And there are some things we could change that would reduce your risk for getting it, right? So this study did a good job of looking at what they call non-modifiable risk factors and modifiable risk factors. So a non-modifiable risk factor is something like age, right? We can't, we want to get older, and most of us do want to get older, and we can't change that. It is what it is. You can't be 29 forever. So you really, you're going to move on in age, so we can't change that. But there are some things that are modifiable, which are some lifestyle factors. So if you look at this graph, and the reason that I think this was particularly interesting to people is it puts it across the life course, right? You start thinking that, wow, there are some things like, okay, I still smoke and I'm 72, would it really make a difference? You know, you start hearing about that kind of thing, right? But there are also some things that are really important in midlife. And, you know, one of the things that I think is interesting here is they talk about education, and they're talking about education before the age of 11. So if people are less educated, they have a higher risk for dementia. So as a society, that's something to think about, right? You know, I mean, making sure across the world people are getting educated, because you get more cognitive reserve, right? You get more synapses in your brain, and you have more there and when your brain becomes damaged. So those are things in early life. But when you look at midlife, some of the things that reduce the risk, and you'll see little percentages on this number, on this sheet. I don't have the handout. Okay. Well, I'll have to walk over here. You see different percentages. And so what they did is they looked at all these risk factors, and they said, if you tally those all up, and we actually reduce some of these risk factors throughout the life course, up to 35% of dementias are potentially modifiable. So this was a really, that was a pretty exciting study, because I think it's really empowering to think that over the life course, if we were to make some changes, if we have a fear and we don't want to get Alzheimer's, what are some things that we could do to keep our brain healthier as we age? So, you know, in midlife, you know, addressing things like hearing loss, hypertension, and obesity. Now, you guys are all health and wellness people, so you know this already. We're already talking about a lot of these things. And then when you get to later life, we could actually make an impact even then. Some people think it's too late, right? But it can make a difference if you stop smoking, if we cope with the issue of depression, the lack of physical activity, social isolation, and diabetes. So those are all things that I think as health wellness people we think about. But I think we've been thinking about them in general, like, oh, we're going to feel better today, we're going to help our heart, which is great. But we're also impacting our future and our ability to age well and to be independent. So that's where this sort of science is starting to come in. And there are more that are on here, and Maggie's going to talk about those later, some other things that are coming out in the literature, but this was the one that they focused on. So we just wanted you to have that, because I think it does reflect sort of the state of the science of where we are in terms of what data is available to show a reduced risk. And the fact that what's exciting is that up to 35% might be preventable if we take some steps now. So that's why it makes sense for us as a state to be thinking about how can we promote health and wellness for people, right? How can we really try to keep people healthy, not only their bodies, but their minds? So here's the thing, from the time you're born, we're all aging, right? So I asked you to think about yourself as older people, but we are aging every day. And the things that we do during our days can either help us age well or impact the way we're going to age that might not be that image we have in our minds, right? So, you know, we're really trying to just get people to think about the fact that our organ is one of our most complex organs. And it needs blood in order to function, right? So it needs the heart to be healthy. We need to get the oxygen up there. We need our brains to be clear and active. We need to take care of them. So that means individually we can optimize our health. You know, we can all take steps to do things like making sure we check our own hypertension. We know that's a risk factor. Make sure that that gets treated. That's super important. More and more studies are coming out now about untreated hypertension being a big, significant risk factor for dementia. And that makes sense, because when your vascular system isn't working right, you're not getting, you know, what you need up to your brain to operate. So it's really important that we all think about that as a wellness thing, is getting your hypertension identified and treated, and diabetes is in that sort of same category. You know, we see a lot, I'm sure you guys have all had that, you know, they're looking at pre-diabetes and testing people now. We're trying to go upstream and catch things earlier, because if we can keep people healthier, they don't have the damage to their heart, their circulatory system, and their brain. So all of that is just sort of tied together, right? So, and then, you know, using healthcare not only just for dealing with problems, but thinking of it as a wellness thing, right? Let's stay well. Let's use our healthcare optimally so that we can do that. So, you know, I think what we're really hoping today is that we can think of this workforce on that life course graph, right? People spend a lot of time at work, and we know that you're the choir. We know we're preaching to all of you, the health and wellness group. that you want to promote health. So we're just hoping that we can integrate this idea of brain health and the importance of staying healthy into some of the other work that you do. Because I think a lot of it ties together, and we're just hoping that we can get it not only to you, but you can get it out to other people. So we're going to talk more about the workforce and how you might do that and some ways you can integrate it. So with that, I'm going to pass it on to Jamie Tuber from the Healthcare Authority. Thank you all.
I'm trying to steal my pen up here as well.
Very nice.
Put that out there. Okay, so thank you, Lynn, for that wonderful introduction and in-depth overview around dementia, Alzheimer's, etc. Before I start, I just want to ask, who is impacted by Alzheimer's? Go ahead, just shout it out.
Everyone.
Me, everyone, right? Our families, everybody. So I'm going to transition a little bit into talking about how brain health impacts the workplace. So again, some of this is preaching to the choir, so bear with me as we go through here, and then we will get to a break short. Brain health does impact the workplace, but a little bit differently than maybe some other illnesses or diseases impact. So when a worker or employee has a decline in their own brain health, they may be absent, not just physically through a sick day, but they may also be mentally absent. So they might be showing up to work every day, they might be coming, sitting at their desk in their cubicle, coming to meetings, going through those motions, but they may not be able to retain from day to day. So that's one really important thing to think about as wellness coordinators, as folks who are aging, because we all are aging, whether or not we want to think about it like that. So that's one piece. That falls right into the next one, which is around productivity and the inattentive, or maybe a brain fog. So maybe they're there and you're used to being able to rely on someone as being your point person or that person who can anticipate your next move. And this might be the start of them showing some of their symptoms. They're not able to be that point person or anticipate next. It increases the stress carried into the workplace, not just for themselves, but for the people around them. So I'm going to take a stab in the dark here and assume that everyone is on some kind of team here at work. So whether they're on a team with folks within their own section, or maybe cross-agency, or even across multiple state agencies and some type of work team, if somebody on that team isn't pulling their weight, then that team suffers, right? Someone else has to pick up that workload. And so it's not just necessarily increased stress for that person who might be feeling themselves getting a little bit foggy, but it also can be stressful for the folks who work around them. And economically, this is the coldest one, but it's also the cold hard truth, is economically, as an employer, when we have a turnover of someone who has great historical knowledge, really great networks and connections, and we lose that person, either through early retirement, or a number of other ways, there is an economic issue. Okay? Because it takes time to hire someone, it takes time to train somebody, etc. In addition to the person who might be experiencing brain health issues, we also need to think about caregivers who are in our workplace. So maybe everyone on your team is great. Nobody has brain issues, which is fantastic, and of course our ideal state. But it's important, the part that I want to talk to you a little bit more about today is around caregivers in our workplace. This isn't something we talk about a lot, because oftentimes if you're a caregiver and you're in a workplace, you are coming to work, you are putting in all of your hours, carrying out your duties as an employee, and then you're leaving and you're going home, and now you're going to your second full-time job, which is being a caregiver of maybe a mom, dad, aunt, uncle, brother, sister, or even an adult child, okay? And there's a number of things, as an employer, as a wellness group, to really think about what does that look like. So up here, I'm not going to read all these to you because I know you all can read. There are some things to really think about, but one of the things I really want to share with you is that caregivers do come in all ages, genders, shapes, sizes, abilities, etc. Because oftentimes, and more often than not, we want our loved ones to be able to age in place. We don't want to have to put
put them someplace, like, some kind of institution, we want to be able to take care of them because that's our human nature. And so we do everything we can to keep our loved ones comfortable and safe and at home. And as a result, approximately 60% are the caregivers, even though they're also probably working, who are women. And the average age of the caregiver in the workplace is around 49. So again, we look around the room, we look around our teams, we look around our agency, and we see a lot of these folks who just fit that bill, who could also be a caregiver. Okay? So there's also health impacts of the action of caregiving. Okay? Just like you could say there's health impacts of being a brand new mom, right? Lack of sleep, for one, right? As a new mom. But the health impact of caregiving is that chronic stress, always worrying, always thinking, what's coming next? Where's the next fork in the road going to come? I'm going to have to make another decision, right? In addition to balancing what their job is, that they do every day to bring home a paycheck to make sure that their family is economically sound. They're faced with emotional, physical, financial challenges, again, trying to balance, trying to make sure they have their own work-life balance, and there's a lot of these pieces. And caregivers themselves are at greater risk of developing chronic conditions compared to their peers who are similar health status but not providing full-time caregiving. So again, something else to think about. As a wellness group, a wellness team, how can we create a really great place for caregivers to be healthy, right? How can we encourage their health? So, speaking of that, I wanted to talk a little bit about our workforce as a state of Washington employee, okay? As the population ages, we will develop more and more folks with Alzheimer's, dementia, like Lynn shared in her slides that had the nice increases. She also shared and touched on early detection, how important early detection is, and how scary early detection can be, right? I mean, if you know it's it, then why do we want to talk about it? Why do we want to face it? But it's really important. In the workplace, early detection, I'm going to give you a couple more benefits to share with folks back in your own agencies. Early detection allows for time for planning and ultimately benefits those who are involved. So as an employer, there are certain benefits to employees when they have a diagnosis, opposed to, I'm just not feeling right, something's wrong, right? Oftentimes we can't give those benefits, we can't share those benefits, which I'll talk about later on after the break, if there's not a diagnosis. So if there is something to be diagnosed, it's real important. We know, so up here this showed us our PEB and our STEB populations combined and then pulled apart. So we know that the Washington State employee workforce is approximately 300,000 people. Okay, these are just round numbers, with the most common ages between 36 and 64 years of age. Before I move to the next slide, I want to touch on a couple things. And one thing in particular is what's called young onset Alzheimer's. Young onset Alzheimer's is when someone between the ages of 30 and 65 is diagnosed with Alzheimer's. While it's uncommon, about 5 to 6% of people with Alzheimer's disease develop those symptoms before the age of 65. That means that approximately 200 to 240,000 people in America have young onset Alzheimer's. So again, remember, we have approximately 300,000 employees in the state agency combined. That's a lot of people with young onset Alzheimer's, okay? So, just some food for thought. Alzheimer's disease is part of the Americans with Disabilities Act. So again, as an employee, if you're diagnosed with something like that, or as employees are, there are protections, there are a number of benefits that are there for them to accommodate. So encouraging good brain health in our workforce is very important because our employees who have young onset dementia or Alzheimer's are very valuable. They're experienced and effective employees, as we've known for years, right? Something's just changing. They've got a new diagnosis. Often in those early stages of the disease, that person is still high functioning and remains sufficient with lots of skills that they can share and offer to the team. So I wanted to share those things with you. So we need to be considerate of caregivers, as well as considerate of those who have young onset Alzheimer's as wellness coordinators as state agency. Okay. I want to make sure we have some time for questions and answers, but I'm going to go ahead and move forward. We are going to hear, go ahead and fire this up, from some family and care partners. This is part of a series of videos that was developed for widespread use. You have a handout in your packet as to where the other videos and this video is, and you are welcome to use them within, throughout your agency, and within the audiences that your agency serves as well. So we are going to watch the tips for family and care partners before the break.
Like, I don't know.
Maybe we won't watch. It did work when we That's okay, we are almost at break. But what I am going to encourage you, because we're 2 minutes away and I'd like to stay on time. But I will encourage you to go back, and when Pam sends out the follow-up, the video link will be in there, and I'll make sure she has it to give it to you outside the slide deck so you can easily access it. But I would encourage you to watch this video along with the others as well. They are very impactful. So as you go through different actions at your agency, know that these are there. We do have questions. We have time for 2 questions. If anybody has any questions in the room?
We can
or
flex
let's
the break a little bit. Please, if questions or comments up to this point are greatly appreciated.
And we'll have time at the end as well, so if you don't have anything formulated right now, we're later on. Okay.
So online, somebody asked if the packet can be available to people listening in over the phone, and yes, that's available on the meetings and materials page already, but will be sent out, a link will be sent out as a follow-up to this meeting.
I just wanted to point out in your packet, this is the page that has all the videos on it, in case you want to go and find that information.
Thank you.
Yeah.
Let's go ahead and take a break for 10 minutes, be back at 11, and we will pick it up from there.
Thank you, Jane.
No, I'm in room to do it.
Oh, you are?
Yeah. No, I told him my husband's career was he was at University of Coast. So he went from Washington to Indiana to Ohio to West Virginia.
Oh, yeah, I'm sorry about that.
I don't know, we got it to work before.
Yeah.
practiced?
You practice.
Yeah.
And in that time, I know before my parents, older gone. I know mom, dad, stepmom, stepdad. And, so all those blessings my sister. And I said, and she's there. And I said, time to move, it's time to figure it out. I don't know.
Let's try and show it.
Okay, we'll show it after.
Yeah, right.
Have
Kick off with it.
Not at all.
It is. But I said,
Oh,
Monday,
okay.
I've had.
I don't.
I remember.
Oh.
He is lining up into all of it.
Okay.
So we got it.
Sounds good.
Oh, but then that means.
Well, what is everyone?
Yeah.
Both my daughters.
They're all
soccer, high school soccer, you know.
Yeah, so,
Like 15.
yeah.
Right up.
Yeah. I just said
We're gonna
that.
show it right
I
after the break.
Should I?
Yeah, no, that's.
It is.
So it won't be long.
Every time you move, it was like. Financial flow just. Yeah, but anyway, yeah, so yeah, we got here and since I knew retirement was in the sure, so we bought a house, a senior loan, side with my husband, house, being able to get security, get on Medicare. Good plan. So, yeah. Yeah.
Oh, absolutely.
Okay.
Yeah.
Can't imagine.
Yeah, we
did.
Okay.
And we'll have it on recording, and we're gonna come back and see if they
Figure out
finding
your favorite gas station. Stuff. Yeah.
Find it, I felt like I was talking about.
Yeah, and it seemed like every time that I got settled, bought a house, I re-landscaped everything, got it just the way I wanted it, redid the whole house, and then it, start all over again. Yeah. It's not bad, except for the move when we left, Ohio.
Yeah.
In West Point.
Yeah.
Just right at that market crash.
It was very clear
We had
and
to
concise.
take it out of that. Plus, so much cheaper in the Midwest, I would imagine, than.
So what was the challenge on that?
Right. I have a brother who's from
I
Iowa.
think it was, you live somewhere or something?
There's two.
Oh,
Yeah.
somebody else.
The computer, that, I don't know why, but we may make it to be.
Yeah, you lived around.
Sure.
Okay.
Yeah.
So
So
anybody in the room would be talking.
we've experienced a lot.
We are.
Settled down.
That's good. Thanks, guys.
Yeah.
Or these are more than coming back to where they were and then.
Yeah.
That is.
I mean, it's for me, it's not for him.
And a lot
Oh,
of
I
the
see.
emails.
Yeah, he was born in Jamaica, and they grew up in Canada.
I see.
We were going to school in
Oh, see,
Virginia.
excellent.
Yeah.
Oh.
Excellent.
Played
Thank you.
professionally in Virginia, Washington.
Soccer, that's right.
We're gonna keep promoting that.
And then
What's his citizenship?
US now.
US, but not
But
US.
Oh, really? It was.
Because you can do dual, right?
Yeah, actually, you can
Especially if they reach out, so they're not making.
You can do triple.
Well, Jamaican, you don't lose your birth.
This in here.
So he has that automatically.
Yeah.
And then he has
A lot of work
Canadian, and they allow you to keep it.
Oh.
Right, and the.
Right.
Things get so crazy.
Excited about it.
Yes, exception.
Depending on what happens.
Well, we'll see.
Is it celebrity? I don't know.
Probably should stop that conversation now.
I know, it's like, politics and religion.
Hi.
You know, discuss
Both
those
times, when I walked in this
Nice
morning,
talking to you, Linda.
had a wildfire, and our
Yeah.
center asked that we, put together a team for a meeting at 11:30
Oh,
to
goodness.
mitigate, a team to respond for, the whole coronavirus thing.
Oh,
And so
yeah.
we're,
Yes, please go do that.
so
Yeah.
we're,
If we get that taken care
so
of
now
here,
we
that'd be
have a hastily planned meeting with a bunch of people that are coming in and at 11:30, so I have to attend that. And so, because they're moving the incident command post from Snohomish County down to Tumwater.
Oh, boy.
Oh.
And so,
Do they think that there's been more people in the United States?
in the United States, no.
Okay.
You know, California's got their share, Nebraska's got, I think, California's got about 20-something. San Francisco just declared a state of emergency.
Yeah.
Really?
So they're doing things down there. They don't have any confirmed cases, but they're just, the mayor decided to do it.
And do we only have the one?
We have one, that when I went up there, he was isolated in an RV, for the next 4 days left over. He's been isolated for 2 weeks. He doesn't have it, he's just monitoring him,
Oh, boy.
and so he's just been stuck in. But, so they asked us to come up there and look at their facility, and now we're putting together a team, because now have to address how we're gonna communicate to all 39 counties as part of DNR lands and communities, and without people freaking out.
Well, we really appreciate the effort.
Yeah.
And thank you for letting us know, and it's being recorded, you know,
Okay.
so we're gonna be
Yeah,
sending
so
that
I
link
really
out.
appreciate the information, and I'm highly, interested in looking more into it. I kind of try to, work with the wellness program for DNR and
Excellent.
within the building, so if you want my card, there it is, and
Thank
just
you.
please stay in touch and keep me
You can do, yeah.
It's like one of the only things
Yeah,
that will
it's
do,
just- yeah,
will, prevent you from getting norovirus.
Mhm.
And it's almost impossible to not get norovirus.
Yeah.
But hand washing.
Yeah. And there's an art and science to it. Yeah.
I taught hand washing for 7.5 years.
Really?
Home care aides have to
Oh,
pass.
I'm
They have to
I'm
pass
talking to
hand
the-
washing
yeah,
to
yeah.
pass the test. And you have to wash a certain way.
absolutely.
And, I have a hard time, so I mean, it's 20 seconds. To wash for 20 seconds.
Mhm.
Yeah.
What if they say sing a certain
Yeah,
song?
they just said happy birthday.
Happy
That's
birthday,
all.
yeah, sorry. Yeah. Well, let's hope that
What we wanna do is,
stays contained as much as possible.
like, those pharmacy products, you know, you plan an order.
Yeah, I'm so glad they're proactive. That's always a comfort.
No, I don't hire airline ones, I don't want to travel.
That was I think what constitutes a pandemic is
How many
that
countries?
yeah.
But I don't
So
remember
multiple
how
countries, it did involve multiple countries.
I think it was.
Yeah.
Maybe there wasn't the level of.
that we're hearing. I don't know.
No.
It's hard to discern if we really should or if it's.
Yeah.
I'm.
Right, yeah. No, our son lives in England, so we were just there in October.
Yeah, so,
And that was
in one of my meetings about a month
when
ago, our leader
you know, we
had to another reorganization.
Couple
years.
Yay.
When we, that's always.
Slow down.
So you're not gonna be angry about it. You're gonna roll with it. Yeah.
I've never been.
He was describing sort of the rate of, question, but the rate of essentially the ability to pass, so we think of the flu, when someone in your household has the flu, the likelihood of somebody else getting, right, like 2.5.
Transmission high, or one.
1.7. Transmission, measles is at a 14.
You have to be in the same room.
Because of dryness and right, and live on the surface, right? And so they were thinking this coronavirus was like 2.5. So it was more contagious than the flu, but not at the level of measles. But, yeah, so.
Yeah, and my understanding, right, today, as of yesterday, I'm trying to get caught up on it, that, it's like the flu, it's the more serious cases are in the elderly and those with, other, like chronic disease issues or, compromised immune systems. And a lot of people that get it, it's pretty relatively mild, actually. That's my understanding, but it's what's frightening to me about, or just like causes cough, it's just these new viruses and these, jumping from species and it's just, how it's gonna continually evolve and impact us, Seems to
I'm not worth it, if you got, or if I got, I would, die. It's a disruption.
I know.
Economy.
Oh, yeah,
The businesses and schools, if we're gonna do what,
and it's already having that impact, like Apple, for example, they do a lot of business in production in China, and that's their stock is dipping and, things like that, so it is affecting the economy,
They were saying they haven't had community-wide or county or statewide type isolation things since big H1N1 back in 2010, and that be prepared for schools. To the closed all.
I forgot about H1N1.
All that. And that was only in a couple places. There's
Okay, so can I regroup and come back from break? We were hoping to, get the video going, but, little audio issue, so again, in the resource packet, there are links to, was it 6, videos? So please, tap into those, to increase your understanding and, even more importantly, share with, through your wellness programming, ways that you can, share those videos and continue to increase awareness around this issue. So I'm going to turn it over to Maggie Christopherson now from the Alzheimer's Association, and she's going to share some very interesting information as far as our lifestyle and things that we can do.
Good morning. Hello. Again, I'm Maggie Christopherson. I'm from the Alzheimer's Association. I'm an education coordinator and trainer. I've been a caregiver since '96, and so I really appreciate the information about caregivers and caregivers in the workforce. They're a very underrepresented population of people. So just a little bit about the Alzheimer's Association before I start. And the reason, I was kind of going back and forth. Should I mention the association? Should I not mention the association? You guys know who we are. But out of families that are diagnosed with Alzheimer's, only 5% actually ever reach out to the Alzheimer's Association. And we don't just handle Alzheimer's. Our name is actually Alzheimer's Association and Other Dementia, but that is very hard to fit on a form. So my job is really to increase concern and awareness. And just like was mentioned before, this is not something that we like to talk about. People do not want to talk about Alzheimer's. My former role, I taught caregivers for about 7.5 years. And they really liked to talk about Alzheimer's. And so I naively thought, I think they liked it just because it was a break from everything else we've been talking about. I naively thought everyone would like talking about Alzheimer's. And my first resource fair, I'm set up behind a table, I've got all my stuff, I'm ready to go. And I'm saying, would you like more information about Alzheimer's? And, most people did not. And some people got even hostile. No, I don't want that. I said, okay, calm down. So I do just want to quickly tell you guys, our mission is to eliminate Alzheimer's disease through the advancement of research, to promote and enhance care and support for all affected, and to reduce the risk of dementia through the promotion of brain health. And so we're going to talk about brain health today. Obviously, that is what we're talking about, but I want you to think about that for a minute. Your whole life, you have been told about heart health and bone health and skin health, right? We've been told about really making sure that we are keeping our body as healthy as possible. But like Lynn already mentioned, if your brain is not healthy, then all of those things that you want to go do with your body are really probably not going to be possible. So I have been thinking more about brain health, and I've been trying to get people that I give presentations to really stop and think, what can I do to keep my brain healthy? I was talking to a man that's going to become one of our community educators, and his wife is, can you guys still hear me? I'm just not a podium person. His wife is one of the healthiest people he knows. She's been a runner, kind of like it sounds like you are, she's been a skier, she's been she's done all these Ironman competitions. She's extremely physically healthy, and she's had Alzheimer's for the past 8 years. And so even though physically she could go do all those things, she cannot do any of those things anymore. So our vision is a world without Alzheimer's disease, and we're not there yet. I don't know when we're going to get there, but what we can do is talk about how to care for our brain. And I know I'm preaching to the choir, but I want us to start thinking not just how we can get ourselves to do these things, to take care of ourselves in these areas, but how can we get other people to start thinking about caring for themselves in these areas? And how can we do it without preaching? How can we do it without annoying them, right? Because when we start talking about this, many times people do what? They shut down, they turn off, they don't want to hear it. Especially if they know you work, for a public health organization or as a public health educator, as a nutritionist, right? They're not listening to you. So how can we do it without being preachy? So we want to think about caring for ourselves one is physical activity. And this is a hard sell for people who don't like being physically active. It just is. I have a 19-and-a-half-year-old daughter who hates exercise. She hates everything about it. She hates the clothes. She hates the sweating. She hates feeling her heart beat hard. She just hates it. She's a very crafty gal. She likes to quilt and sew and make jewelry. She does a great job. She's at Evergreen, so she's in the right place. And I was thinking to myself, well, why doesn't she like exercise? I like everything she hates. And then I thought, but I don't like crafting. You know, I hate to craft. It sounds like torture. And what if somebody said, to get my heart rate up, I would have to sew or make jewelry or make, sit down at a sewing. I can't even thread a sewing machine. I mean, there's no way I would do that. And so I started to think, okay, well, I can't approach this in an exercise way. I have to approach this just in a different idea. So your brain has over 100 billion neurons. That's a lot of neurons. And your heart beats roughly about 120,000 times a day. Here's the thing I think is absolutely fascinating. Every time your heart beats, 25% of your blood supply goes to your brain. That's a lot. And if a quarter of my blood supply is going to my brain, then that tells me my brain's a pretty important organ, right? And so the thing is what's good for our heart is also good for the brain. So what's good for your heart is good for your brain. We need to increase our heart rate. We need to increase our heart rate, but we have to think beyond conventional, typical exercise. Because if we look at the stats of who's exercising, it doesn't seem like we're doing a very good job to get people to exercise if only roughly 10% of the population exercises, right? I told you guys I used to teach caregivers. I taught caregivers for 7.5 years, and these folks are busy, they're tired, oftentimes they don't have any money, they are really squeezed. And I would try at the beginning of my career with them to get them to think about exercising, and they would just look at me like I was crazy. Once I moved away from that and I started to say, okay, you don't have to go join P90X. You don't have to join a CrossFit box. No one is asking you to be an Ironman, participant. But how can you just get your heart rate up? What are some ways that you can just get your heart rate up? That's all we're asking you to do. So walking. Walking is one of the single best forms of exercise you can do. It doesn't require any special equipment. It doesn't require you to join anything or to pay anything. You can do it anywhere. You can do it in increments during the day. And the other thing is, when I look at running, I love running because I'm addicted to endorphins. That is it. It's not because I am a superior athlete by any stretch of the imagination. It's just because I like the endorphins, which is why everybody loves to run that runs, right? You see all those runners, we'll see each other in PT offices. Somebody's got a hip at a joint, their knee doesn't work, and they're like, help me. And they keep running anyway because they're addicted. But you don't see that with walking. You don't see that people are getting their knees replaced and their hips replaced and they're really having a hard time. It's really, it's an exercise that you can just keep doing. So any of these, dancing, gardening, where's my gardener at? Yeah, do you get your heart rate up gardening?
If I'm lifting rocks and stuff like that, yes. Weeding, probably not, but yeah.
Well, even weeding. You're going down and up, you're outside, if you're digging anything up, if you're moving anything, you're still getting your heart rate up, right? Yoga, biking, housework. Housework raises your heart rate. Lifting weights, swimming, mowing the lawn, walking your dog, especially if you have a crazy dog like I do. Zumba and kayaking and hiking and all of these different things. Even marching in place. I mean, if somebody really was strapped for time and they were caring for a loved one and they couldn't go anywhere, they literally could put on some music and dance around their living room for 10 minutes. I mean, it's better than nothing. And it gets our heart rate up. Playing with your kids. My kids are old, they don't want to play with me anymore. So as long as your heart rate is up, keep it going. Anything, other things that I didn't say that you guys can think about are the folks on the phone that get your heart rate up.
Technology not working.
Technology not working, yes. Maybe overscheduling yourself.
I mean,
Yeah.
can I ask a quick question?
Sure.
There are things during the day, stresses, that will get your heart rate up, but that's not the good
No,
heart rate up,
because we
right?
don't want cortisol in it.
Right,
So
right.
the cortisol isn't very good for you. It's actually pretty bad for you. So we want healthy heart rate.
Yes.
Yeah.
So along the lines of technology not working or choosing not to use technology, so walking to go talk to somebody instead
Yes.
of sending emails and getting up to go drink often,
Yes.
like setting up these things, parking,
Oh, I love that.
intervention where you just have to walk a little
Absolutely.
bit more and not feel.
Yeah. Parking far away, going to different grocery stores. Yeah.
Using the restroom on a different floor than the
Ooh,
floor
that's a
you're
good
on.
one. Using the restroom, not using an elevator. What else? Maybe getting a group of coworkers together and saying, hey, we have 15 minutes. Let's go do some squats. Let's go do some wall sits. Let's go walk around. Let's try to get our heart rate up and still talk. Anything is better than nothing. Anything is better than nothing. Oh, question or comment?
Just a couple people on here had comments. Yoga was one of them listed, and then someone else said anytime we raise our arms up, it increases our heart rate, even if it's while sitting in front of a computer.
I didn't know that. We should all do this for the rest of the time.
We should have an arm raising campaign at work, you know, the wave. Everything it's wave time.
I like that. So absolutely. And when we look at diet and nutrition, this is another place where when you bring it up, people will oftentimes just shut down. Talking about diet and nutrition is difficult. There's a lot of different reasons. There's a lot of shame that goes along with it. There's a lot of confusion that goes along with it because it feels like recommendations are being changed all the time. There is culture that goes along with it. There is, emotions that go along with it. When you're thinking about eating something that you ate as a kid and it really was comfortable and it made you feel good and maybe it's not good for you, but you really want it. So all of those things can make it difficult. So what I want everybody to think about for you and then for people that you work with is what are some things that we can do to just start thinking about small changes? When we try to overhaul our diet and make huge changes, oftentimes we are not super successful. So one of the diets that we talk about is the Mediterranean diet. It's very heavy in fruits and vegetables, lots of colors. They recommend salmon 1 or 2 times a week and a lot of water. Lean meat if you're going to eat them. A lot of legumes, a lot of beans. They also mention the DASH diet, and this is for reducing sodium and what Lynn talked about, trying to look at our hypertension, right? And if you think about it, hypertension is one of those things that there aren't any warning signs until it's really gotten bad. So I have a family history of hypertension on both sides of my family, and I'm always asking the doctor, what was my blood pressure? And now I'm getting so nervous about it, though I have to be like, hold on. Okay, take my blood pressure, I'm fine now. So what we can think about is not just this black and white idea of good and bad, what I can eat, what I can't eat, but what I need to eat more of. So nuts, seeds, legumes, beans, whole grains, all of these things we want to increase because it's funny to me that they talk about protein. Americans are not really deficient in protein. We really aren't. We are deficient in fiber. We are very deficient in fiber, but we really aren't deficient in protein. So I'm not saying don't add protein, but think about fiber because fiber is low calories. It fills you up, it keeps you going, and it's healthy, right? about lentils or, you know, black beans or refried beans or, you know, walnuts. Walnuts are so good for you. They're one of the foods that the Alzheimer's Association talks about as being a superfood that can try to prevent cognitive decline. Lean meats and fish, fruits. And here's the deal, they don't have to be fresh. We would like them to be fresh, but if you live on your own, it's hard to keep fresh fruits around. If you live someplace not, you know, in those, what do they call them, food drought places, fruit desert, yes. And it's hard to get to a grocery store that has those things. Fresh or frozen is almost just as good as fresh, especially if it's flash frozen. So think about really colorful fruits and vegetables. And olive oils are really good for you. So what to avoid? And I should have put what to avoid most of the time. What to avoid, you know, and sometimes eat. Because depriving ourselves doesn't work, or at least it doesn't work for me. So saturated and trans fats, most of the time we should try to avoid this. Most of the time we should try to really eat this as sparingly as you can. But if it's been a month since you had a cheeseburger, have a cheeseburger. You're probably not going to die, right? But saying I'm never going to have it again sometimes can make people really do what? They're craving it, right? So again, processed foods. I really try to avoid processed foods. If I can't understand the ingredients, if I can't read it, if it's really long, well, I'm going to avoid it most of the time. But there's this candy I like that you can only get at gas stations, which tells you all you need to know. Only sold at the gas station. It's these red cherry sour balls. They're so delicious. I mean, there's no way these are good for you, right? But I eat them every couple months because I like them. They're good. I just don't eat them every day. So again, foods that are high in sodium and sugar, if you are looking at trying to reduce your sodium, you're going to have to get away from processed foods. You're going to have to get away from boxed, canned, or frozen. If you start looking at the sodium levels, it is very difficult. It is very difficult to stay in that low sodium area if we're trying to eat fast food, boxed, canned, or frozen food. Deep fried foods and unhealthy fast foods. But what I really want you to think about and get the folks that you work with and the people you talk to think about is, okay, let me look at my diet. Let me think what is the most egregious thing for me? What is the worst thing I'm doing? And then how can I make small changes around that? And that seems to work for me. I have a real sugar issue. I love sugar, like a lot. And I've tried not eating it because I've heard all the stuff that it's like cocaine and all that stuff. But it will just make me crave it. And so if I just eat it a couple days a week, I'm good to go, right? If I don't, then I crave it and I gorge on it. So think about small changes. So cognitive stimulation was already mentioned, and we have all of these neurons, and with these neurons, we have all of these things called neural pathways. So every time you learn something new, your brain creates a new neural pathway. And some of those neural pathways are so well entrenched in your brain, and those are the things that you do without even thinking. Driving to different locations, cooking familiar recipes, whatever. But as we get older, we need to create more neural pathways. And the way that we do that, I was talking to a brain health coach up in Snohomish County a couple weeks ago, and she kept saying new and novel experiences, new and novel experiences. So doing something new, learning something new, and let's look at how we can stimulate our brain. So learning a new language, even if you don't become fluent, even if you couldn't go to that country and completely converse, just the act of your brain having to learn that new language is forming that new neural pathway, and it's stimulating your neurons to fire, and that's what we want. Reading, learning a new skill, so learning how to do something new, especially with technology. I'm Gen X, so I'm in that generation where I was young when technology came out, but it still wasn't like a part of my daily life. And I found myself, every time something new came into the house, I found myself just giving it to one of my kids. Here, figure this out, and then tell me how to do it. Just, here you go. And then I realized I really am missing out here. And so what I do now is I make the kid, whoever it is, show me how to do it. First, I try to figure it out on my own. If I can't figure it out, I look it up. If I still can't figure it out, I just make them show me over and over again until I can figure it out. And I think when we do that with technology, we're giving our brain that cognitive stimulation, and we're also training ourselves that, yes, we can learn something new. Yes, we can. Doing word puzzles, crossword puzzles are not as a hot commodity as we thought they were. It's because you're retrieving already learned information. It's not as good as we thought. You know, for years we've been telling people crossword puzzles. Like, oh, we ever said crossword puzzles and Sudoku, and you'll be fine. But it's just not true. Don't stop doing them, but they're not really as great as we thought. So driving a new way home and not using your GPS. I don't know how we ever existed without GPS. I really don't, but I've been trying to use it less. You know, some of these sound really silly, but using your other hand to brush your teeth.
That's hard.
It is hard. Writing with your other hand. Putting your leg through your pants on the other leg, right? So walking a new direction for exercising. Anything that is new and novel. Just trying to get your brain to get some new neurons, or to stimulate neurons. Yes, sir?
Mousing with your non-dominant.
Oh, that's a good idea. What are some other ones that you guys think of? In the back? Oh, you were just scratching your head. I apologize. Do you have a suggestion?
That might be one. No.
Throwing a ball with your non-dominant.
Oh, throwing a ball with your non-dominant hand. That's a good one. That's hard to do. What else?
I think anytime you change up your normal routine.
Absolutely. And traveling.
Yeah.
I forgot to put traveling on there. Traveling is difficult. You're in a new culture. You don't know your way around. You have to figure out how to converse with people. It's hard, and it really does stimulate your brain. Yes?
Looking for new things on, even on a typical walking pattern.
Yeah.
Just looking for new things.
Oh, that's a good idea. Yeah, especially if you lived in your neighborhood a long time. You think you know it all, and just looking for new places. Yes?
Talking to yourself.
Talking to yourself? That's not bad. Your neurons are firing. Why not? Is there more science behind that? We'll have to look it up. Okay, so now let's talk a little bit about, I don't know why my clicker stopped working.
Sorry.
Hey. Okay, social engagement. And I've noticed as we get older, it is harder to remain socially engaged. I don't know if it's just people get more tired, or maybe it's because we're busy, or maybe because there's traffic, or maybe it's the seasons. I don't know what it is, but lately I've realized that I don't want to go do things like I used to, but I still want to be invited to things. But I don't actually want to go. Don't stop inviting me. I want to be included, but I don't actually want to attend.
But one thing for sure, and I echo that, I don't want to drive in the dark as much.
Right.
My eyes more glare.
Absolutely.
And it's subtle, but after a while you're thinking, it's going to be dark when I
Yep, or it's going to be cold, or, I've already done so much stuff today. You know, sometimes it feels like another work day, you know, if you pack all this action in. But the thing is that not being around people, not being socially engaged, again, I'm preaching to the choir here, is associated with living living shorter time and with more disabilities. It is not good to be isolated and alone. It is not good for people. And so some of the things we can do is to make an effort to visit friends, visit family, joining a book club, volunteering, game nights, meet your neighbors. It is shocking to me how many people don't know their neighbors. Meet your neighbors if you can. Say hi to people at the grocery store. Start up, they might look at you kind of weird, but whatever. Try online dating or online meetups or, networking. We have a lot going on here in this region. I used to teach on the other side of the state, and then I would teach down south sometimes. And in these really rural areas, it is not as easy to remain socially engaged as it is here in our more populated areas. Anything else that you guys can think about?
Get off social media.
Get off social media, yes.
Yeah.
Meet people in person. Maybe call people on the phone.
Yeah. A novel idea.
Yeah.
I know. Oh, okay. So let's talk about 10 ways to love your brain. So the first one we talked about breaking a sweat. We talked about cognitive stimulation, making sure that you're not smoking. And I get it. Smoking is very addictive. I smoked when I was younger, and it was very hard to quit. But if you can't quit, to try to at least reduce the amount you smoke, and then to try to join a smoking cessation program. There's a statistic, it takes people an average of 7 times to quit. So don't give up, you can do it. So following your heart, making sure that you're keeping those numbers in check. So your weight, your blood pressure, your cholesterol, because all of those things can affect your cognitive health. Heads up, so wearing a helmet. I am a little bit of a helmet freak because I've cared for so many people with traumatic brain injuries and seizure disorders that when I see people on anything that moves without a helmet, I kind of want to shout, do you enjoy headaches? Do you like frequent outbursts, seizures? I mean, seriously, it does not take a lot to get a head injury. It really doesn't. And our brain does not heal like we used to think it did. It really is a delicate organ in that way. So eating, we talked about that. Sleep. We had our big research symposium last, I think it was in April, and they taught, and I think Lynn knows about this too, they talked about there were so many articles and so many presentations on sleep and what the lack of sleep is doing to our brain and doing to almost every health issue that we have. And there was this talk that was given where they talked about the fact that it's only in the last 35, 40, maybe 30 years that we've really been doing this as a country, kind of glorifying that we're not getting any sleep, kind of saying, well, I'm so busy, I only slept 4 hours, and really not taking any steps to kind of rein it back in. And what they're showing is that it is horrible for your brain to not sleep. The brain health expert I was telling you guys about was talking about that there's a mechanism in your body that cleans your brain at night, and it can only do it during REM sleep, and it can only do it if you're getting over 7 hours a night. So I know it sounds like crazy talk, but really thinking about getting off the social media, not having a TV in your room, going to bed and waking up at the same time, keeping your room cold and dark, and making sure you're not having alcohol or caffeine right before you go to bed that you're eating. All of those things do help, and I actually had to do that myself because I wasn't getting enough sleep, and I've been doing it for about 1.5 years now, and I am actually getting 7 hours a night, and I feel 20 times better. That means I get up at 5 o'clock in the morning on Saturdays and Sundays, but it's better than not sleeping, right? So taking care of your mental health, I was listening to folks at a presentation a couple weeks ago talk about how, many of their loved ones have depression and they're not getting any kind of treatment. We know that that is not good for the brain. Just like having hearing difficulties and not getting those treated, having depression and not getting that treated is terrible for the brain. And a lot of folks think that they have dementia, and really what they have are some symptoms of depression. And then we talked about stumping yourself, so cognitive stimulation and social engagement. So I think I'm at my time, or I'm over it. Okay. Are there any questions or comments? I don't want to take anybody else's time.
There was one comment online, when we were talking about how to make small changes in your diet without changing everything. Somebody said that they, when they were a dietitian, they would tell their clients to buy more of the fruits and vegetables that they already like, to keep them around to snack on, and so that they were there, they already liked them.
Yeah.
Just eat more of them, and then it helps them develop ongoing.
That's a good idea. Well, you guys have been wonderful. I'm going to sit down and eat some cashews now.
Oh, thank you, Maggie. We'll keep things moving along here. We're going to get to our last section. And that's, looking more closely at ways and exploring and having a conversation about promoting brain health in the workplace. And this slide represents some main categories and directions you can go as far as integrating brain health into your wellness programming, increasing awareness, educational opportunities, et cetera. So I'm going to just briefly touch on each one and then hand it over to first Jamie, then Kim, because they're going to share some different, some specific examples in these categories. And again, we'd love to get your initial ideas and thoughts. Maybe some of you have already included some brain health focus with your programming and with your employees. So first of all, I wanted to let you know that the toolkit. So one of the health observances in June is Alzheimer's and Brain Health Awareness Month. And the Alzheimer's Association does provide a toolkit each year for that. The one for 2020 will be up and available in May. And from last year's, it looks like a great opportunity. There's different things and approaches you can take to increase awareness, education, et cetera, around these really important issues, Alzheimer's and overall brain health. So we will be sure to send you an announcement out when that's available with a link. And we also plan to develop a customized smart health activity tile around, promoting for that month also. So we'll keep you posted there. Stay tuned for that. And then moving on to affinity groups. And what I mean by that, they're commonly known as employee resource groups, or even more commonly known as support groups. And there's a wonderful opportunity in the work environment to offer affinity groups. And Jamie will be talking about how they're developing one here to offer at the Healthcare Authority for caregivers, and how that, that process and what they hope to accomplish. So that's something to consider. And it doesn't have to be just specific to caregivers, knowing your employees, what their needs and interests are. There might be other opportunities to offer, employee resource groups in different areas and topics and such. And then the last couple is about, integration. Integrate, what I mean here is, we've learned today that, we do a lot of this promotion in these key areas already. We promote tobacco cessation and dietary, issues, physical activity. And the Alzheimer's Association provides a wonderful resource, and it is in the packet, that has evidence-based messaging in these key areas that we already generally promote. Again, from tobacco prevention and cessation, eating healthier, physical activity, et cetera, high blood pressure. They have evidence-based, already written messages that you can draw from and add to your existing campaigns in these areas to add that integrated approach and say, oh, this is also good for your brain and this is why. So you can integrate into what you're already promoting. And then also what we learned, there's evidence is showing some key lifestyle areas that can be promoted you could develop a actual brain health wellness initiative, and we hope that the resource packet provides some opportunities to do that. For example, the Alzheimer's Association has a really great brochure. It's in the packet as far as, prevention, and we've also included the 10 Ways to Love Your Brain handout. So the message I'm trying to kick off here in this area is that you can look at what you're already doing and integrate some brain health messages into that. They're available for you. You can have a standalone wellness initiative around brain health, maybe a focus on, campaign 10 Ways to Love Your Brain, lunch and learns, et cetera. We'll chat about different opportunities in a bit. And and then the toolkit, as far as focusing on a health observance month, could be an opportunity for you to promote brain health. So I want to stop there because I want both Jamie and Tim to have plenty of time to share more specifics in these areas.
Okay, so we're just gonna jump right in. Here at the Healthcare Authority, we are working on standing up an affinity group or support group, employee resource group is what it will be here. Where this came from, it was really a grassroots request. We held a lunch and learn back in November here at the Healthcare Authority that really targeted any employee that wanted to learn more about dementia and brain health. And many of the people who came because they have a family member they are caring for or already have identified themselves at a higher risk due to family things. And so we're in the forming stages, and the purpose is really to supply not only resources, but also to supply support to our Healthcare Authority employees who are also having that role of being a full-time caregiver. What we found in our lunch and learn and some of our early on meetings is just because you are a caregiver doesn't mean you leave your workplace and you go home to provide physical care for somebody. We have a number of employees here, as I would gather you probably do too, who are serving as a caregiver from a distance. So we have a handful of folks who their parent lives across the country, but they are the point person to ensure that appointments are being kept, medications are being taken care of, so they're kind of doing that care management from a distance and what that looks like. So it's an exciting time that we're working on standing up. If you have more questions about what that looks like, please feel free to contact me. Shifting gears a little bit, becoming an employer or employer of choice with caregivers in mind, here are some additional things to think about with the caregiving. Some of this is very similar to the Infants at Work. Okay, so with the Infants at Work program, we have a special room for lactation. And so again, a private area for phone calls, being flexible with scheduling, knowing and understanding that. When there's resource fairs, providing additional information that might be an assistance in your community or your county, providing information from the Alzheimer's Association around additional information that might benefit employees and employee caregivers. Offering remote work and integrating information into the orientation materials that new employees get. And last but not least that I want to share with you is here are just 4 things that as a wellness coordinator you can connect with your human resources folks around gathering and learning more information about these things that state employees have access to. They're different programs. So the employee assistance program, that is probably the most commonly well-known one, the number you can call to get assistance with different things. And the vast of information that you can get from them is very wide. It's a great program. Then there's the next 3, which I'm not going to talk in detail today, but they are hyperlinked, so when you get the slides, you'll be able to go directly to the site. But the Family Medical Leave Act is the federal protection that somebody has if they are going to be out for a period of time. And the Paid Family and Medical Leave Act is Washington's version of that. And the requirements as to how you qualify for each of those is slightly different. So the reason that I point this out is because if I were going to be a caregiver for, say, my father-in-law, who is my in-law, I would not qualify for FMLA, but I would qualify for PFML. So it's important to know and recognize that. It's kind of, makes you scratch your head a little bit, but it's one of those pieces that is there. And then there's the special leave, which is the family care emergencies provision that's afforded to all of us as state employees. So just a couple extra resources, things to keep in mind, and even information about these things would be really great in the resource there. All right, so without further ado, I want to pass it over to Kim Sessions from Department of Health.
Jamie?
Yeah.
Hi, everyone. So today I'm going to talk a little bit about just, how to be a facilitator of some of these different areas. One of the easiest ways, one thing that you have in your toolkit is the messaging support from the Alzheimer's here. So adjusting your current healthy behavior messaging to include little tidbits about brain health. One of my colleagues, Sarah Eve Sarlicker, took the ball and ran with it at the Department of Health for Heart Month this February and kind of got us going on adding in heart health and brain health together. So what's the message about what's good for your heart is also good for your brain, right? And weaving those in. So some examples here on why you should quit and weaving in living longer, quit smoking for a healthier brain and body, right? So here's another example. Exercise is not only good for your body, it's also good for your brain. Getting regular exercise that makes your heart beat faster, which increases the blood flow to the brain, right? So things like that. Taking care of both your heart and your brain, eating a healthy diet can help support your weight and your brain, so things like that. So you have this brochure and 10 ways to love your brain. So thinking about how you can integrate these messages into your communications. I use this graphic in my new employee orientation. I can speak to it while we're doing a little stretch break. I can hone in on any of those factors. One piece of this graphic that surprised me. So over the last year, I've been participating in a work group with Marcy Gadd, just kind of learning more about brain health and what Department of Health is doing and messaging and where the gaps are. And so it's been very interesting to me, but what I didn't realize was how important the social connection was. And that is a way that we can be a facilitator. We can facilitate social connection in developing programs. We can facilitate it in our orientation. We can make equipment available that might help facilitate that for teams. So reviewing your policies that support people is one thing that you can do. Work with your HR team or look at that. Developing a policy in place to support social groups. So Jamie mentioned the employee resource group. So we have, this has been an initiative at Department of Health over the last year. We have 7 employee resource groups and 2 of which I started. But the next one I really want to work on is the caregiver support group because I know there is a lot of interest around that. So that's great. And let's see, so highlighting smart health, I know there's going to be a smart health tile around brain health coming, right? Yes. So be looking for that. Offering group activities that encourage team options. So when I develop a wellness program, I'm thinking about how can we encourage team involvement. We promote smart health, some of those team challenges, you can kind of weave that into your messaging, you can weave that into your group activities. For we have a public service recognition week coming up in May, and we weave in wellness activities into that week, and we weave in social connection and opportunities into that. So for example, getting people up and out of their chairs to go find something in like a scavenger hunt, right? And I can encourage people to do that with a group, with their team, with a friend, with a buddy, or do it themselves, right? And gives them alone time to do it in case they're mobile or busy or, they have some time there. So another thing that I've done recently to encourage team options is I've invested in some team building equipment that teams can check out. So for example, like just things that can liven up your team meetings. Sometimes you have off-site meetings, sometimes you might have long meetings. It might be just a team building exercise between, that's really quick in a meeting that facilitates social connection. We have like cornhole and ladder ball and beach balls that have different interesting questions on them, things like that, that help our managers come up with ideas to support social connection, right? So if you learn more and you have a reason and encourage ways to break down those barriers and to connect with people. Another thing, so recreation and social connection was really important to me, and I said that when I came to the Department of Health, I was going to bring recreation with me. And the first thing I did was, it took a while, but I got it. I got ping pong stuff. I had to get a space, and we got it, so now we have it in 2 buildings, and we have over 60 people playing ping pong.
Nice.
Wow. So, and they're meeting people from different groups, and it's stress relieving, and it's social, and they're doing it on their breaks and their lunch, and they're enjoying themselves. Collaborating with other groups within your agencies. For example, the combined fund drive, right? So we've done a walk run, right? And we raised money for a veterans group, and we incorporated education, right? We are collaborating, so that's a big initiative with the Department of Health this year, is collaborating with Combined Fund Drive to do more wellness-related things. And then including agency-related pop culture. So trivia things can be, so not everything has to be physically active. I mean, we love physical activity, right? But as she mentioned, sometimes that can turn people off, right? There's lots of different things. I try and look at different ways. We have mental health, we have, some people just really love trivia, right? And we celebrated 30 years as Department of Health, and that was a big theme this last year. And so we had a pop trivia. We had trivia for Department of Health, and then we had specific different trivia night, and they used it as a combined fund drive activity, right? Another thing I've done is somebody gave me these, and I'll pass them around so you can see what they are. These are mind puzzle cards that you can look at, see how challenging they are, decide if you want to incorporate it into a newsletter or an event that you're having. So I've kind of done that. I've thrown it into a newsletter now and then, and some of them are extremely challenging and not something I would be able to do, but it might be able to be a team activity. Right. All right. So what I like about these events are the sharing and ideas. This is the very best part of any training here with PEB, is networking and sharing. And I'd really like to hear from others what ideas you have or what you've done to incorporate brain health into your program. Any ideas? Any things that you'd like to share?
Tim, thanks for the information. So one of the things within the Washington Healthcare Authority, we support agencies, higher ed, and K-12 now, and a lot of different types of organizations that we have the Smart Health Program, which has sort of a holistic approach to health, so that cross connection, that overlap between sort of emotional health, financial health, work-life balance. In addition to a specific, let's say, brain health tile or activity where you get points, and you can earn $125 off your health deductible, it looks like there is, that's something that in a general sense, you can kind of swim in it there. You know what I mean? You can kind of do a lot of things that indirectly help. Maybe if you're not specifically talking about brain health. And then also one thing that we do through Pam walked her through her brainchild is this idea of having a brain health forum and presentation is having just that, and a a place where people learn and network, so kind of make it all meta.
Thank you, Justin. Anybody else? Anybody else, got ideas on, if you haven't yet started to weave brain health into your, program, ideas that you have or things that you were gonna do as you leave here today? Yes.
I definitely want to, include this information, even if it's just kind of like a plug. We do a wellness for leaders and a wellness for employees. And it talks about the 5 domains and kind of, you know, what we can do. I have a question though. I thought I read somewhere, and I don't know if it's, I don't know where I read it, but aren't we allowed, employees allowed some time to do wellness activities during work? Like, I thought it was okay to do your smart health assessment during work. But beyond that, I thought somewhere I read, like, you have up to like 15 minutes a week or 5 minutes a day or something where you can, as an employee, like, I don't know, do something wellness related. Do you know anything about that?
At our agency, we allow de minimis employment security. We allow de minimis, so you don't, if a person wants to go get a 15-minute chair massage, they don't have to do it on their 15-minute break. They can do it as long as their work is caught up and their supervisor knows where they are, you know, there aren't disciplinary problems or anything like that, then they're allowed that 15-minute or even a 30-minute chair massage outside of their break or lunch. We wouldn't allow someone to take 4 hours to go, you know, do something like that. But it's, so far, there haven't been, knock on wood, there haven't been any complaints, but you know how the agency is.
Do you recall anything like in the governor's executive order or WAC?
Can you speak to that?
I don't think there is a prescribed time that you can take.
Yeah, I'll just real briefly, I know that, you know, the state ethics board has rules specifically on smart health, 15 minutes to do that. And then what does that state ethics board govern over the different organizations that, you know, that have access to, say, smart health or the 10% benefits? Is another question. So one thing we also say too is that, you know, check with your local leadership and see if it's in your local policies, et cetera, because that's going to be, you want it to be seen there so that it's not something you're promoting that sort of gets big.
That's right, because it could vary by agency or organization. So, I'm hoping that, so do we have any ideas or anything to share online here?
Well, that was fortuitous. Boom, there's one on there. We can implement more brain teasing activities or games as part of our wellness program, weekly or monthly quizzes, and possibly daily dose with small prizes.
Yay, great idea.
Great idea.
Yeah. All right, so I'm gonna turn it over to Pam for
Oh,
closing.
okay, yeah. Thank you so much for all the presenters today and sharing your expertise and ideas. It's so appreciated, excuse me. So, I guess, for me, it's about looking for existing opportunities. You know, what are you doing already maybe, and how can you add another level of richness and information and awareness tied to this very important area, brain health, you know, dementia, Alzheimer's, et cetera. So, I hope that you all, you know, from the packets and the great information you received today, that you go back feeling motivated and look for some of those opportunities and start incorporating these messages and focuses for you. And then also, there's a short evaluation questionnaire in the back of your packet, and we would so appreciate it if you could take a couple minutes before you leave today to complete that for us. And for those of you online, via the webinar, we'll be sending out, you the short questionnaire, and would really appreciate your taking a couple minutes to complete it and route it back to us. If we want to, we're always interested in, you know, what's working for you, you know, how you can use the information, what we can do better that informs our ongoing focus and what we bring to you to help enrich your wellness program. And then lastly, I know we had how many join us via, 70 joined us today. The GoToWebinar. That, I think, is a record, and we're so jazzed about that. And some of that reflects that, you know, as most of you already know, that we've added the K through 12 employee group. We call them SEB, C of acronyms around here. And that we just so welcome all of you that have joined us for the first time from that group today. And just again, putting a plug in, you know, that there's various resources we offer and are available for you to promote wellness with your employees. The Smart Health Wellness Portal is certainly a grand resource, very comprehensive, as Justin talked about as far as the, you know, all the domains of wellness and holistic approach. And there's an incentive, of course, you know, this wellness portal is available no cost to yourself, your spouses, domestic partners, and an opportunity to earn an incentive, the $125 incentive. So I would be remiss if I didn't say, just remember that incredible resource that's offered and tapping into that and promoting that as well ongoingly with your employees. So anyway, any last comments or questions? Okay. Well, thank you. You guys have been most gracious today. Take care.
Thank you.
Thank you.